Good afternoon, myself Dr. Sadaria. I'm a student of the third year B physiotherapy and my today's topic in the PFD is the goniometry of the shoulder joint. So the goniometry is the measurement of the joint angle and the range of motion using a goniometer. The purpose is to assess the range of motion, identify joint limitation, monitor treatment progress and document the patient status. The general principles of the shoulder goniometry. The equipment used, which is the universal goniometer. The patient preparation. First, we have to explain the procedure to the patient, expose the shoulder region, stabilize the trunk and the scapula, and measure both sides for the comparison to identify which is the affected and which is the non-affected. So for the shoulder flexion, the normal range of motion is the 0 to 180 degree. The patient position is the supine. And the patient need to flex their knees to flatten the lumbar spine. The fulcrum is pointed at the lateral aspect of the greater tubercle of the humerus. The stationary arm is located at the parallel to the mid-axillary line of the thorax. The movable arm is located at the lateral midline of the humerus towards the lateral epicondyle. The movement we need to command the patient to raise their arm forward and overhead. Precaution: we should take care of the trunk extension and the lumbar arching to prevent it. The next movement is the shoulder extension. The normal range of motion is the 0 to 60 degree. The patient position is the prone line and the fulcrum is pointed at the lateral aspect of the greater tubercle. The stationary arm is pointed at the parallel to the mid-axillary line. The movable arm is pointed at the lateral midline of the humerus. The movement, we should command the patient to lift their arm backward. The prevention is we should avoid further trunk rotation. Shoulder abduction. The normal range of motion of the shoulder abduction is 0 to 180 degree. The patient position is the supine. The fulcrum is pointed at the anterior aspect of the acromion process. The stationary arm is the parallel to the sternum. The movable arm is the anterior midline of the humerus towards the medial epicondyle. We need to command the patient to lift their arm sideways to overhead. Precaution: prevent the lateral trunk flexion and the shoulder elevation. Shoulder abduction. The normal range of motion is to 180 to 0 degree. The patient position is same as the abduction, supine. The fulcrum is pointed at the anterior aspect of the acromion process. The stationary arm is parallel to the sternum. The movable arm is the anterior midline of the humerus. Movement, we need to command the patient to move their arm towards the body. We need to take precaution of avoid the trunk movement. Shoulder internal rotation means the medial rotation. The normal range of motion is the 0 to 70 degree. The patient position is the supine. The patient shoulder is abducted to 90 degree and also the elbow is flexed to 90 degree. We should keep a towel under the humerus. The fulcrum is pointed at the olecranon process. The stationary arm is pointed towards the perpendicular to floor. Movable arm is pointed along with the ulnar towards the ulnar styloid process. Movement, we need to command the patient to move the forearm towards the print. Prevent the scapular protraction and lifting. The shoulder extension rotation. The normal range of motion is the 0 to 90 degree. The patient position is supine. The shoulder is abducted to 90 degree. Elbow is flexed to 90 degree. we should keep towel under the humerus. The fulcrum is pointed at the olecranon process. The stationary arm is perpendicular to the floor. The movable arm is pointed along the ulna towards the ulnar styloid process. Movement. We need to command the patient to move their forearm backwards towards the head. Precaution. Prevent the lumbar extension and the scapular elevation. Thank you.